everyone. We're glad to see you today. So we are going to start a new process of briefing everyone, hopefully daily at the same time so that we can get out a consistent message. I'm going to start with a quick situational update and then we can take some questions and answers. First and foremost, we do have our fourth case that we had confirmed this morning, and we did notify our media about that. I'm going to tell you a couple of details about that case. So first of all, this is an individual who is in his upper 20s and is someone who was attending a college down in Madison. And so we believe that this individual may have been exposed actually in the Milwaukee area. So this is someone exposed here in Wisconsin. Was there between the 13th and 15th, and symptoms began on the 15th. Symptoms for this individual included initially some minor muscle aches, and then quickly overly tired. On the 16th, developing a sore throat. On the 17th, a dry cough. And then on the 18th, fever and chills. So the classic symptoms, however, understanding when they came about with this particular case is helpful to know. The individual came back to our county on the 15th and has been in isolation since the time that they came home. So gratefully, there is not a lot of exposure, no exposure essentially, besides this individual's significant other, who is also a college student and has been in isolation as well with the spouse. So that essentially means that our contact tracing is focused on connecting with other communities where this person was during the potential exposure period, and that includes Milwaukee and Madison as well as Eau Claire. So we're in contact with those areas to let the health departments in those areas and any facilities that they were in let them know about the potential exposures there. As I indicated, this person is in isolation, has not been around our community since coming back home to La Crosse County, and had some classic symptoms that we are normally looking for. So those are the details about the fourth case. Starting from this point forward, what we're going to do is no longer notify about every case that comes along. We will have a daily update on our website at a specific time, and we'll let you know when to look for that. However, the first case that we identified to be community spread, meaning we can't find where someone had traveled to a specific location, for example, that we'd be concerned about, we will notify immediately within that 1 to 2 hours of when we get that particular case. And I say 1 to 2 hours, but do understand it has to be enough time for us to find out that there was community spread. So it could be that the case comes into our system, we're actually doing contact investigation, and then it might be a little later than when it actually comes into our system, but it'll be 1 to 2 hours from when we determine there is community spread with this particular case. A couple of the things that I want to address, we're getting a number of questions, and I want to clarify some items for those in our community. So I want to talk a bit about the contact investigation process. There have been a lot of questions about why don't we notify about a particular location where someone is, about where they live, where they've been, all of those sorts of details. And that's because we have investigation staff who have done communicable disease investigation for decades, and they have lots of experience with having communications with those individuals, motivational interviewing to determine where those people were, who they might have been in contact with. And it's important here to note the disease process and how the disease process works. So with this particular case, we're talking about, or this particular virus, we're talking about spread by droplets. And I've mentioned this before, but I want to reiterate it. I think it's really important. So when someone coughs or sneezes into the air and you're within 6 feet of that person, you might pick up those droplets from the space between you. And then in addition, if you cough or sneeze and that lands on an inanimate object, there is potential that someone who isn't sick touches that surface and then brings it to their face and exposes themselves. And this is why our messaging continues to be social distancing, staying 6 feet away from anyone else, particularly if you know that person is coughing or sneezing, you do want to keep your distance. But even if you don't know that, I think that's just the best mechanism that we can protect ourselves. In addition, it's the washing your hands, it's the cleaning of the surfaces around you and not touching your face. And that helps you avoid potentially contaminating yourself and exposing yourself to the virus. So I think those continue to be really important messages based upon what we know We are getting a lot of questions from particular sectors, including child care providers, those that do personal care work with an individual in a close contact setting. Again, it is keeping social distance whenever possible. It continues to be the messaging of washing your hands and not touching your face. If someone does have a cough or is sneezing, I think you would want to raise that up to your manager. Like say, for example, you're working for a personal care agency or home health, for example, you would want to raise that up and say, I would like to know, in order to determine my potential exposure, I want to know how you want me to handle this. So I think that level of communication will continue to be really important. I do want to indicate that after yesterday, the health department in particular has really ramped up our incident command system. And those of you who might understand what incident command is, it is a process that helps organize situations like this where we continue to get cases. We're going to continue to get cases. Now we're spreading out, having nurses and other health department staff who are really good at contact investigation. They're heavy into that work. We need to then redeploy all of our resources in order to make sure we have messaging going up and down that chain in a way that we can be really effective for our community. So I tell you that because I want the community to understand we take this very seriously and we're doing a really good job of managing our resources in order to respond to this for our community. We want to make sure we're taking care of ourselves so we can continue to take care of you. And we are doing a very good job of that, and our partners are doing the same. I do want to let folks know that we have gotten a number of questions about testing in particular. So I'm going to let Bridget take it. Bridget is from Gunderson Infection Control. And I do just want to indicate we did invite both Mayo and Gunderson, and we will continue to do this for our daily briefings. And one or the other will be present based upon their availability at this time each day. So please don't think that we are only inviting one agency, for example. But Bridget, would you talk a little bit about testing?
Yes, for sure. So Bridget Path, again, Administrative Director for the Infection Control Team at Gunderson. And I would emphasize related to testing and whether it's the travel. We obviously saw 2 days ago, we were talking about 0 cases in La Crosse County. Today we're talking about 4. This is going to continue to elevate. And we are also seeing information on testing on a national, state, and local level changing. So important message for everyone is call before you come in, because somebody who we may have tested yesterday may not qualify for testing today. Meaning we know that there's some areas that there's going to be spread, and we want to make sure that we're conserving tests for appropriate people. Those people would include the extremely susceptible patients in nursing homes and long-term care settings, people who live in that community area. Where is the risk? We're asking everyone for that social distancing right now and to isolate at home if they're sick. When's too sick? What does that mean? We're posting information on our website, what you need to know as a member of the public for prevention. As Jen said, we've got decades of public health surveillance. We've been working with most of these people, myself, for 2 decades, have been working with a lot of these people. And those relationships and those contact investigations in this community, we are working with great partners. We're on the phone with our colleagues at Mayo, our colleagues at the health department. I think we had maybe 5 phone calls this morning. So it is constant collaboration and communication and partnerships and sharing. Our testing criteria is changing. If you call and you're screened, we don't need to test every single contact in a household because there's a quarantine or isolation order suggestion in place. We also will continue to evolve the criteria related to I went to Chicago or I went to California. Which of these people need to stay home from this point on? Most of the things are closed right now. If you need to go out and get some groceries, certainly be thinking about wash your hands, and then wash them some more. but then also be thinking about the other things you can do. You know, you might want to get outside and take a walk, but we don't want you to just gather all the teenagers in your basement because they're off of school. So thinking through, again, all of those different pieces, the lab testing, and then going into this touches every aspect. And if we're all doing the right things, the hope is we're going to interrupt that curve. We're all reading about that. But what about this? And I read this, and in such and such a state. Go to your most reliable resources. La Crosse County Health Department has some great resources. We have things on our website at Gunderson. Obviously, I'm surprised the CDC website hasn't crashed this month with everything happening, and we want to make sure that we're thinking through what they're bringing forward as well. The CDC website, there's a lot of unreliable information out there right now. Go to your trusted references.
Thank you, Bridget. And I'll just reiterate, in terms of testing, remember, if you have symptoms, the message would be stay home. And that if you have questions about those symptoms, you would want to contact your healthcare provider, and they will appropriately triage you through to determine if you need to be tested. And I just reiterate, we don't need to know the result of a test to know if we're symptomatic, we should be staying home.
Yeah, I would say, because I don't want to say, well, this is the group we're testing right now, and this is the key things are what I said, those long-term care people, essential workers, healthcare workers, our folks in the police and fire that are protecting ourselves, depending on the situation. Again, there's different people who are going to make it into that group of people who are being tested. We want to be thinking about it could, if we had a new test approved, if we got a new shipment, that those orders could change tomorrow on what ability and where to go for testing and screening. We talked yesterday about a drive-up ability to test at both healthcare facilities in our community. We're working on increasing that capacity throughout our regional sites. Not every single place will be a testing site, but we want to make it as available as possible within our system.
Question.
Mm-hmm.
I'm not sure exactly who it's for, but so feel free to chime in, either one of you. Can you tell me when it comes to testing, does it sound like you think it would be a good idea to test more people? I mean, you keep saying that there are asymptomatic people, plus you have people who are in the healthcare industry like yourselves, the nurses and doctors that are treating people. Do you want to try to get ahead of it so you're testing people to make sure they don't have it so you're not saying it to work?
So I'll just start by saying this is a balance in terms of making sure that we have enough testing supplies and the ability to do those tests. And I think that that balance comes back to continuing to test based upon risk. So I think it is important to recognize there's a balance, and we can't just test everyone. We don't have the capacity right now across the whole system to do that, and we want to make sure that we are making the testing available for the critical folks that we really want to make sure we understand if they are positive. That's why the message would be, if you have symptoms, stay home.
So short of testing, what do you tell everyone who's working at, let's say, Gunderson Health System, as far as what they should know to maybe not come to work?
Mm-hmm.
So we've always practiced by the same guidelines. When is sick, too sick? And we put those out for our employees. They're posted. Those are things that we're doing every single day. We're really enhancing when is sick, too sick right now for our employees. We've never before had active fever checks at our doors. Those are things we're talking about today. We may say, if you're an employee and you meet this travel criteria where maybe you were in this place, but you're not on the list of the tier 3 highest risk areas that you traveled to. However, are you doing fever checks at home twice a day? Some of those things that we're everybody's reading about all the different things you can do, but if you are thinking you need to put a mask on to even go in public, if you're running a fever, stay home and ask somebody else to bring your groceries and set them on the front porch. And we may not screen you for the virus right now because, again, resources are limited, and we're looking at making sure we have enough to sustain our community as a whole and really care for the most vulnerable in our population.
And I just want to add that when we look at the risk level, we are really trying to identify, for example, we are looking at modified quarantine processes, for example, with healthcare workers. We use the science and the evidence that we have from the cases across our county, the state, and the nation to determine we are typically seeing symptoms in this window. So if we do a modified quarantine period, for example, of the 7 days, stay home based upon risk, again, they may or may not need to be tested. Then when they return, we're doing, I know Gunderson or Mayo are working on systems to check those employees when they return to work. So we're in conjunction about that process to make sure we are following the science and the evidence, and recognizing we also have to balance with having enough healthcare workers available to serve.
How come there are differences between what the DHS reports and what the cross-county reports when it comes to positive results throughout our area?
Yeah, I can't answer that necessarily. We are all referencing the same electronic disease surveillance system, but I can tell you that the La Crosse County reports about the number of cases that we have here are accurate.
And how do you guys work to make sure that it's the most up-to-date as you can be?
Locally?
Mm-hmm.
So that disease surveillance system is electronic, and those cases are coming in, it's immediate. Our nurses are right here, our disease investigation staff are right here in this same floor, and we are immediately updating that. If the lab report, for example, comes into that system, they're working in the same system to do contact investigation, we know those things immediately. So that is just innate to the work we have. That is right there for us to know how many cases there are, which is why we can effectively and quickly let the community know how many cases we have.
And I would say we have evolved in our systems. So as Jen said, the WEDS and the state reporting system that we're using, that was a very manual process 2 days ago. My staff were over entering each case one by one as we tested patients. And now we've reached a point where we have an automatic upload into the system. So those are the things. We have many, many experts across every spectrum of the healthcare system, whether it's supply chain, our experts in employee health, our partners even the patient experience department. Everyone is playing a role in this. Infection control isn't just my job. Jen's not the only person worrying about the public health right now. Everyone in this community should be adhering to those things, washing our hands, making sure we're practicing that social distancing, thinking through all of those components to drive home the point of we all have a place in this, and everyone's a partner in public health right now.
I do just want to clarify. So the entry of cases, so for example, what Bridget was talking about is when they do tests, they can upload the test, the paperwork relating to the test, but then the specimen gets shipped off to the lab. And when the lab report comes in, it comes in and dumps directly into the same surveillance system. So if for example, we're behind in terms of entering the tests, we're still going to get that lab result in there. And sometimes we'll get that before we get the paperwork relating to the test. So just understand there are different pieces that come into the system, but it is very quick as soon as that lab result comes in, especially on the positive side. Mm-hmm.
I know you mentioned doing daily fever checks, maybe twice a day. What would you say to people who can't get their hands on a thermometer right now? I know they're sold out pretty much everywhere.
So they are, again, we've all had that experience of looking at the store shelves in the last few days. I always, the touch of a mother is always sometimes more reliable than a fever check by a formal process. But I think I would say right now, if you suspect or think you might have a fever, if you're not so sick that you need to be seen, give a call to the telephone nurse advisor, screening lines at either health system, and use our resources that we have available at this point. I can't magically make 100 thermometers appear and go drop them off door to door for people at this point. But I think all of these things that are happening today are going to help us all be thoughtful about what we need in our lives as we plan for that public health piece.
And I think continuing to be science-based here and looking at the cases that we've had, recognize that fever wasn't immediately present for all of these. So it comes back to, how do you feel? And if you aren't feeling well, you really should be home. And therefore, whether you have a thermometer or not, it's okay that you don't. You shouldn't be out and about if you don't feel well.
Well, we'll talk about the vulnerabilities of the elderly population. These confirmed cases in the cross have been somewhat relatively young people. Is there anything you can glean from that based on, I guess, the earlier reports or anything that is surprising or expected?
So I'm going to pause because I think we're doing maybe not the best job of one thing, and is that repeating the question so that all of our friends can hear this. So of all the people in La Crosse County that have been tested thus far, many of them we're finding, or the confirmed cases aren't the highly vulnerable, the people we would expect to see.
Yeah. So whether or not we can glean something from that, other than just gratitude that we don't have yet individuals that are in those high-risk populations getting sick, I think that's really important to note, because we all know we could be exposed to this, and we don't want to transmit that to those that are most vulnerable. So I don't know that there's a pattern or a trend yet that we can talk about, except that we're just grateful that that is not being transmitted yet to those that are older or have underlying health conditions. All of these individuals are not severely ill and are able to be home and not in the hospital.
And I guess it can happen. Or that anyone can have.
Again, it comes back to, yes, anyone would be susceptible to this virus, but we would be looking at their exposure risk. So that's why we do a lot of the social distancing to minimize the exposure risk, because that comes back to the droplets and the touching inanimate objects that might be contaminated and then contaminating ourselves. Okay.
I'm wondering if you can speak to whether any of the cases in the county are from community spread and when you might expect it to peak in this area, and whether or not anyone is hospitalized.
Okay, so repeating the question, is anyone, are there any cases right now that are from community spread? The answer is no. They are all associated with travel. The second question, Maggie, was, is anyone hospitalized? No one is hospitalized. And when do we think that this might peak? We aren't sure of the answer to that question. We continue to see cases climb. I expect that to continue. We could be looking at weeks, maybe longer before this peaks. We just don't know the answer to that.
Can you speak on UWL having to do a deep clean this morning? They talked about if that's related at all to any of these cases here.
I am not aware of the connection there.
So can we speak on UW La Crosse doing a deep clean? Well, I think this is something that a lot of public institutions are deeming, whether they're closing doors and making it more secure to enter, doing active screening like us, or deep cleans. We're not aware of any direction to them or from us related to things. So I think just the specifics of everyone's job is infection control right now. And those are things we are all thinking more about, what disinfectant is in our availability and in our area, and what are the things maybe people like me and Jen were always doing in our lives, and what are the things that everyone else is now paying a little bit more attention to.
When you talk about resources working together with Mayo, what are some of the ways that Gunderson is coordinating with Mayo? What kinds of information are you need to share? And are you really working still separately, or are you very much working together?
So the question is, what are we doing to coordinate with our partners at Mayo, and what are we doing separately, and what are we doing together? I would say separately, there's healthcare workers in each facility working on how is this actually going to flow in my department when it happens here. We are having joint conversations, and those conversations are happening between Mayo, Gunderson, and the public health department, saying, this is what we've done for the last 24 hours. What are you working on? Are we all looking to the future? Meaning, how do we interrupt that curve? How do we interrupt that? What are those specific steps that you're putting into place? Where might there be an ability to test patients outside? That's what both healthcare systems are now doing. other things for the future conversations and the more recent things is how are we working together to have the same message go out in terms of how long should employees stay home if they have had some recent travel? What is that screening? What are our partners in employee health using and doing to ensure that we're following through? Future things that we will continue to talk about is that ability to surge, where we're at today with testing versus where our partners are at today with testing. And we will continue, I expect to see all of these things continue to change day by day, and not get into all of the specifics, but to say really it's important that we are communicating because there's no competition in infections. I don't want to see it traveling or spreading in our community. We want to make sure that we're all sharing our information.
I like what you said there, Bridget. No competition. I have been very excited about the level of information sharing happening across all of our agencies. We've discovered that there are discrepancies, for example, in the way that we're encouraging quarantining of various individuals in these two healthcare institutions, and then we find that and we have the opportunity to change that. And I think that level of vulnerability in working together is exactly what the best partnerships are made of, and I'm excited to say that we're really doing that very well.
Have you had to repurpose any of your employees to other departments to figure out how to meet the need, and are you planning for that? If this is obviously out of control.
So the question is, have we had to repurpose labor pool? And discussions of people doing different jobs has been a significant conversation. I can tell you there's a lot more people helping support phone calls in the infection control department than there ever has been before. Employee health is receiving some support right now. I would see those labor pools starting to change as we transition through this. The impact that this is having on every workplace across the state, that schools are closed, daycares are impacted. Those, where are they putting their priorities? Fortunately for us, one of the priority areas is essential healthcare workers. Those are things that, yes, we will continue to do that, and we are continuing to partner and monitor in the community and look for potential resources for other ways of supporting. We've done some, if you think of the long-term care setting, taking somebody out of the nursing home right now may not be the best. What are some alternate ways, and who are some partners we can continue to collaborate with to continue to do the right thing for everyone in the community, not think about me, but think we.
And have there been some real changes that you've either made in the facilities themselves or the process when it comes to your urgent care, ER, or how your hospital is set up, as now you know you're going to have these patients? What have you had to change?
So what are some things we're doing to change in our flow, whether it's emergency or the front door of our clinic? The number one thing we've continued to emphasize for a couple of weeks here has been call before you come. Make sure that you alert your healthcare provider. If your appointment might be canceled, we will call you. But if you are sick, call us. We may direct you to specific doors. We're creating surge pathways. We're creating safe ways to bring people in. And we are discussing what are some alternate ways. Look in our history books and think about tuberculosis sanitariums. There used to be hospitals for sick patients. Those were right here in La Crosse County. Infectious diseases aren't a stranger to our society, to our people. They're something that we've never experienced something like this. We've talked with many of you through the years about influenza or Lyme disease or summer picnics, all of the things year over year. This is something none of us has ever experienced. It's something, though, that we've practiced and planned for a long time, and we will continue to evolve and get our priorities in place. And the biggest priority in that is, I see, as communication.
Can you just clarify on the surge pathway, just because we aren't medical? You can say, what does it mean?
So what does a surge pathway mean? So a surge pathway would mean suddenly there's the curve is coming, or we're on the front end of a lot of sicker patients needing to seek medical attention. Again, when I say call first, none of this replaces. If you feel that you need to dial 911 for what's going on in your health, dial 911. But surge pathways are whenever we think we're going to have an influx or a larger number of patients that need to be admitted or be screened in an emergency setting, you may be seeing different signs at our front doors very soon because of all of that.
You mentioned
Will you also just clarify what community spread means?
I can do that. So what community spread means is that we might have, like, if and when we get an individual who has a positive, who is confirmed to be positive, and we do the contact tracing and we find out that that individual has not traveled to a location that we anticipate where they might have picked it up, has not been in contact with someone who has confirmed COVID-19. So there is no known source of exposure. That means that we have community spread. They picked that up somewhere locally as opposed to getting it through travel.
you mentioned you've been talking to counties of where these different cases have traveled. Has that been reciprocated? Has anybody talked to you about people that traveled across? So you kind of have to be on the lookout for?
That's a good question. So the question is, have other counties called us and told us about potential contacts? I can't answer that. I anticipate that has happened, but I'm not in that workflow here specifically. So I'm sure that they have received calls from other health departments. That is the normal flow of notification when we understand that someone's been in another county and we know they're here as a resident, they're a positive case, or they're in another county as a positive case. Yeah, that is the proper protocol to contact other counties.
And when we keep saying different numbers of DHS in separate counties, does that mean that there could be more that people don't know about?
Yeah, so the question is, could there be more than just the cases that are reported on the Department of Health Services website? And I think that that is possible, because if we think about confirmed cases are those that are lab confirmed, and there are household members that, for example, if you're a confirmed case and in that household someone else becomes symptomatic within 3 days of when they were in contact with you after you traveled, then we would consider that to be a case as well, but that wouldn't be a case that is reported because we don't need them to go and be tested. So I think it is possible that household members, there could be more individuals than that, and that would be true for all across the nation. But that is the mechanism we have to determine the number of confirmed cases.
Can I ask you as professionals and how this works? When the county or the governor decide we need to put more stringent measures in place where fewer people are out and about, are all of you the ones who weigh in on that?
That's a good question.
I just don't know which way the flow of information is going.
So I would say the question is about the flow of information, particularly when there's a governor's order, like an executive order, an emergency order, or the Department of Health Services sends an order out. There are also health officer authority within local counties where we can make decisions about, canceling events, closing down situations that would help to prevent the spread of disease. That flow is not one direction or another. So right now, what I can tell you is in the situations in the past few days, primarily those have been coming from the governor or the Department of Health Services, and then we find out about it and we try to support and assist with that in our own communities, there are pros and cons associated with that. One of the pros is that then it's statewide and it isn't sort of a hot pocket of which county did this and which county did that, and then we don't have the level of sort of oversight across the state. So that's the pro. The con is that it's difficult for us to hear that information and then have to respond and react to it. But that is the nature of emergency situations. It isn't always perfect, and we then communicate about that to try to improve it even within the same situation and incident, so that we can do that better going forward. So these are fluid situations that we try to work through as we go.
Are there similar challenges with that communication with the DHS about reported cases.
So are there similar questions with the DHS about reported cases? I would also contend and add related to the specific related cases, but also thinking about a system like Gunderson. We have 19 counties. Our employees don't all live in La Crosse County. There's no line at the county line that says automatic stop for all cars. And using the county lines and the specific numbers aren't as important at this point as Jen was discussing earlier, as when we start to begin to see community spread that's not linked to, well, that person was at the airport last week. I'm confident that's where they were exposed, or that person was just in Italy or was exposed to somebody who was sick who was in Italy. All of those links, widespread community transmission is something that we're all hoping that the actions taken in the last couple of days will help to minimize or at least delay. We don't know what those numbers. Getting stuck on the specific numbers isn't as important as thinking about how our society lives and the crossing of, we have a border crossing. Gunderson serves patients in over 19 counties in 3 different states. Now you have 3 different governors of data and governance that we're sorting through. And those are things that we bring to the table when it's our partners at Mayo and our partners at the county to have that conversation and say, let's think about this because it's a broader base impact. We have many employees who drive right across that river to come to work here every day.
A follow-up to that. A few questions on Facebook. I'm not sure there's a great answer. When do we think life might return to more normalcy? How long do we think some of these, emergency orders and things might last?
Yeah. So the question is how long before we are able to have a sense of normalcy? I think that we should be prepared for this to last longer than we might be thinking about right now. This is not going to be a matter of weeks. This is going to be, I think, a matter of months. None of us have any kind of a way to see the future and how this might actually turn out. But what we do want to see is that those cases are smaller in number and go on longer period of time in terms of case numbers continuing to pop up, rather than a very steep curve of case numbers happening, because the point here is to try to not overwhelm the current systems we have in place to handle this and care for individuals. So we do talk about that curve. That is the point. We do want to spread that out on purpose, and we need to be prepared that may mean that life is disrupted for a while.
Someone just asked you if the first case in Eau Claire County had anything to do with this one. I think some people are we just had a 4th case in La Crosse County, and Eau Claire County had its first case.
I'm not aware of the connection between the Eau Claire and the La Crosse County case, but we certainly can let you know if that is a connection we determine to be true. Thank you all for coming.
Thank
We
you.
really appreciate it.
So from here on out, are you thinking you're striking?
I don't know. Ask Paula that question. What do you think in
I
there?
think we thought we would try to do the strike,